platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local. Good morning, everyone. Gareth Presh, founder of the World Health Innovation Summit, and this morning's WHIS Talks, I am delighted to welcome our guests from Kenya, Kisumu Cancer Centre, and our discussion is on cancer treatment in Africa. Let's start with a round of introductions, and if we could kindly start with Lamek, could you kindly tell everyone who's listening or tuned in to this discussion who you are and where you're from?
Thank you so much, Gareth. My name is Lamek Oyochola. I work at Kisumu City Cancer Organization. It's an organization that is focusing on cancer awareness, and also we are working closely with patients and survivors in partnership with the main referral hospital around here in Kisumu. We are based in Kisumu. Yeah, so that is all about Lamek.
Thanks very much, Lamek. I think we'll go to Helen. If you could do a very short introduction, Helen, that would be fantastic. I think you're on mute. Hold on. There you go. You've muted yourself. Go ahead. We seem to be having a bit of a technical problem there. Maybe we'll go to Millicent, if I've got that correct. Could you do a short introduction? I know you're joining us. Hi, Millicent. Can you hear us? Or we've lost Millicent. I think she's frozen. Let's go to Humphrey. Humphrey, hopefully we can hear you.
Thank you so much. I'm Humphrey, a clinical practitioner at St. Monica's Hospital in Kisumu. I'm a member of the Kisumu City Cancer Organization as a medical representative offering technical assistance. I'm looking forward to having an interactive session in this discussion. Thank you.
Excellent. Let's try bring Helen back in if we can, and we'll hopefully have a signal. Helen, can you hear us? And I think you just need to unmute. I think you just need to unmute.
Helen, unmute, please. Please.
Okay. I'm Helen Okello. I'm a nurse working in Kisumu, Jaramogi Oginga Odinga Teaching and Referral Hospital. Are you getting me?
Yes, yes.
Yeah, I'm Helen Okello. I'm a nurse working Jaramogi Oginga Odinga Teaching and Referral Hospital. I'm a palliative care nurse. I'm an oncology nurse. I live in Kisumu. Teaching and Referral Hospital. I live in Kisumu. Yeah, I'm done.
Gareth, you are muted, please.
Sorry there. Millicent, can you hear us? No, unfortunately, we can't seem to get Millicent at the moment. Okay, so let's start the discussion. Lamek, perhaps you could set the scene. Tell us a little bit about what cancer services are available currently at present in Kisumu, for example, in Kenya, and then maybe give us an insight into what you think the patient needs are, and what does the future of cancer care look like for Africa?
Thank you so much, Gareth. Just to start with, one of the challenges that we are having here, especially in Africa, is that cancer treatment for a long time, it has been centralized. And you realize that patients are traveling very far, coming to seek for treatment, especially in the major cities around Africa. So that is one of the challenges that a number of patients are facing in terms of cancer treatment and getting access to the services. For a long period of time in Kenya, we have only two comprehensive centers, that is Eldoret and also in Nairobi. But out of these two comprehensive centers, we have around 7 cancer centers. The two are government and the rest are private. So there are a lot of challenges in terms of accessing the services for the ordinary citizen who cannot pay for these services. So far, we are seeing that since the county government came in place, we are seeing that now they are trying to spread the cancer treatment centers around the country. But so far, you realize that they are only putting up the building, putting up small clinics that can only accommodate very few patients, but not as many as the number is rising up. In Kisumu, I can say that we have oncology clinic, and also we have staffs and oncologists and nurse, as Ellen will speak out. So in Western Kenya, for a long period of time, Kisumu has been the center for cancer treatment in Western Kenya, but people are still traveling from far. In the future, I want to see a situation whereby anybody, anywhere within Africa or within the countries in Africa, are they able to access treatment within their reach, not like traveling for a far distance to look for the service? Yes.
Excellent. And Helen, maybe from your perspective, from a nursing perspective, can you give us an insight into, what the patient pathway is? And I mean, what is the situation on the ground at the moment in terms of once you're diagnosed? What is the formula, should we say, the pathway in terms of, local clinics? How does that process work?
Okay, thank you. Yeah, it is a real challenge when it comes to treatment once a client has been diagnosed. Yeah, if you don't have, like in our government hospitals, it is only national insurance health cover, which is catering for treatment. So most of our clients, they don't have national insurance fund. Some have never even heard of national insurance fund card. So it is a real challenge for them to start treatment. So this one makes them to delay, even if it is to be started immediately after the diagnosis. They have to register for the National Hospital Insurance Fund card, which takes 3 months for it to get matured for use. So that is a longer period for them. And as Mr. Lamek has also mentioned about the distance that they are traveling. So it makes them, when they come, we talk of insurance card, they have to go and plan again for 3 months. Maybe coming back, seeing them, it will be too late, or some may not even come back. Maybe some had succumbed, something has happened. So it is not very easy. Very few can manage to have a national insurance card as they start the journey, but majority, they don't have. They are not even able to get it.
So I mean that, you know, we all know that it's, you know, so important to be diagnosed early, get appropriate treatment. I think the message here is that, you know, it has there's a lot of work, there's a lot of gaps there, there's big challenges. What you're saying is that we need to work hard in terms of bringing together solutions. I think mainly around investment as well, there seems to be a big challenge there, because, you know, with cancer it's important to diagnose early so you can treat early. I'll ask Humphrey, maybe from the psychological perspective, the impact then that has, given that treatments are likely to be delayed, and given that the diagnosis is made, I would envisage that causes huge anxiety and stress, which adds to the outcomes.
Okay, thank you, Gareth. I can say that less than 2 decades ago, cancer in Africa was more or less a disease which was seen as for the rich. And the community perspective towards this was like the affected people could afford their treatment without problems in any part of the world. But today, cancer has penetrated all boundaries, be it political, economic, and even religious boundaries. And currently, it is affecting even the poorest person in the community. So, in terms of the psychosocial support to cover these patients during their treatment, mental health needs to be taken care of effectively. And as Lamek and as Helen have shared, most of these patients don't get the comprehensive treatment they deserve, and because of limited resources. So they could at times travel around miles to receive radiotherapy, for example, which is exhausting and really them mentally, who attend to patients on a daily basis, most of whom are HIV positive. And the current worry is the upcoming of these NCDs among these patients and the general population. And this do then, I can say, entangled with limited resources, at some point lead to fatigue and premature mortalities. And this has raised the mortality rates in Africa like up 70%, that is annually. So mental health needs to be taken care of in terms of this treatment. And looking into the future, I look at the future where a patient can walk in a facility, receive these services at affordable rate, and walk out without much struggle. And also on the psychosocial counseling has also been incorporated as part of the treatment plan for this. And that's a good move toward the fight with cancer. And as so when we review this data routine, we see that there are several opportunities for us And also, we see we have a lot of work to do to improve on these.
Okay, I think we've just seemed to have frozen there, Humphrey. Let me go to Lamech in terms of actually, I've just seen Millicent has joined us. I don't know, Millicent, can you hear us? Millicent, can you hear us? I don't know. Millicent, can you hear us? Millicent,
I can hear you.
Okay, it'd be great to have your perspective. I understand you're a patient, and it would be really great to have your journey. If you could introduce yourself and share your story, it would be fantastic. If you could introduce yourself and share your story, it would be fantastic.
Okay, I'm Millicent, 30 years old. I'm in Kwale County in Kenya. I was diagnosed with breast cancer, and I've undergone treatment, chemotherapy, mastectomy, and radiotherapy. Now I'm on tamoxifen for 10 years. This is my first year. Yeah.
Thank you. And could you share just with the audience, because you know it's important to hear your perspective of where are the gaps? What do you think needs to happen? I know that digital technology in the future. I mean, I think you know these conversations. You know, having awareness. Could you share just with the how do you think that can happen? Can help? Hear your perspective of where are the gaps? What do you think needs to happen? I know that digital technology in the future. I mean, I think you know these conversations. You know, having awareness. How do we think that can help?
Okay, first, cancer treatment has been a burden to many patients because it is so expensive. And so if the cancer drugs can be, at least the price to be slashed, or even some drugs could be made free, it will be very good, because most of the patients cannot take care of the treatment burden. And also where we have slept a bit is the part of the counseling. I presume that when one is diagnosed, the first step should be counseling. Where to me, because I never underwent any counseling after being diagnosed until when I had already started treatment. That is when some counseling came in, but at first it wasn't there. So at least our medics should put that in mind, that what we really need is the counseling for us to understand what is this cancer, how does it affect you, the treatment plan, how will the treatment affect you, so that at least we get prepared psychologically. Yes.
Gareth, you are muted, please.
Sorry there. Thank you very much, Millicent, for that important insight. It's vital that we have patients share their knowledge, share their experiences, so that the service consistently can be improved with co-designing solutions. Lamech, you're in the process of doing a lot of work around digital awareness, digital technology. Please tell us about some of the work that Kisumu City Cancer Organization is pretty much pioneering in Africa in terms of, you know, Kenya raising awareness about cancer treatments, but cancer awareness as a society, because I think that needs to be amplified, probably more so now than ever during the time of COVID-19, because that's all we hear about at the moment. And you know, we have a situation where NCDs are being neglected. So please tell us about the initiatives that you're engaged in around digital awareness and using digital technology as a way and a means to support patients, to support clinicians, to share that knowledge.
Okay, thank you so much, Gareth. As we know that there are a lot of changes when it comes to health management and the entire spectrum. One of the things that we are focusing on currently is digital health advocacy. We realized that when COVID came in, a number of things stalled, especially in Africa here. And one of the best way to reach out to the community, even the patient currently, is on the digital platform. So we in Kisumu City Cancer, we do have Zoom meetings every week, and these ones we do them together with the doctors and nurses around. They bring different topics, and what Millicent has just said was our topic yesterday, and it's very good that since we started discussing about the health issue on digital platform, something cropped in, and at the referral hospital currently, Fridays are left for mental health support for these newly diagnosed patients. And Helen will talk about that. Apart from having Zoom meetings every week, we do a lot of Twitter digital advocacy, and also Facebook and Instagram. One thing we are focusing on is that we want everybody to have the information at their hands. In their phones, we can reach them. In their sitting room, we can reach them. At their homes, at their work, we can reach them with the information. And we are also trying to tell the community where they can get services easily, at their convenience. And also, we are linking them with the doctors so that they don't need to travel as far as from Migori, which is 200 kilometers. We give them the number of these doctors. They talk, they book through the phone. So they only come to see the doctor. So that is what we are doing as Kisumu City Cancer Organization. Apart from that, also, we are also engaging in radio, and we are also engaging with the local TV as we do other awareness events, such like walk. We do bike riding. We do quite a number of events. Yes.
Thanks, Lamek. Helen, are you there? I just want to make sure that we can see you appropriately. If you could, actually, we've just lost Helen. Humphrey, perhaps you could come in and give us a bit of an insight into the digital program that Lamek's talking about. If you have any insight, and talk a little bit about how you can support mental health and well-being in terms of cancer. You just need to unmute. We seem to have lost Humphrey there. Let me come to Millicent. Millicent, can you just give us a bit of an insight into what you think the future of cancer services in Africa should look like in terms of, from a patient's perspective? How do you think that they can improve patient care from your perspective? And we think, well, unfortunately, we've lost Millicent as well. Lamech, myself and yourself are left at the moment, just waiting for the others to come back in. Some technical problems. Tell me, in terms of the future for Africa, in terms of African healthcare, and the opportunities that we see in terms of digital healthcare for cancer services, where do you see the next 12 months, given the challenges of COVID-19?
Thank you so much, Gareth, for that. COVID-19 has really taught us very many lessons. And one of the things that I would want to see in the next 12 months is that we should reach a point whereby a patient does not need to travel a far distance. A doctor can just check on the patient on digital health platform through either medical technology, whereby a patient at home talk to the doctor in Nairobi, talk to the doctor in South Africa, talk to the doctor in India, talk to the doctor anywhere in the world. So that one in itself also will improve the patient health, and also at the same time, both mentally and also physically, the patient health will be improved. And also, I realize that sometimes patients are traveling, yet there are services that they can get around, because doctors sometimes don't want to do their services without the patient. But with the digital platform, hello, are you getting me?
We are. Go ahead. Go ahead. Continue.
Okay. So with the digital platform, everything is possible. A patient can be in Kisumu, a doctor in Nairobi, and then the patient will explain the condition, and the doctor will prescribe whichever medicine, and the patient can send all the treatment documents after doing the investigation. And based on that, the movement here and there will be at least managed.
Thanks for that, Lamech. Humphrey, perhaps you could give us an insight into how digital technology can help mental health and well-being and awareness for cancer patients in Africa, given the high prevalence. And then I'd like to have a little bit of a chat with Millicent, and then we'll have some final thoughts.
Humphrey, you are muted.
Don't know. For some reason, we're not able to hear you at the moment, Humphrey. It must be something to do with a bit of a technical problem. No problem at all. Let's go to Millicent. If I will bring you in on the solo view. Millicent, from your patient perspective, could you tell the audience about what you think is the future of patient care in Africa? You mentioned about the cost of drugs, and what would you like to see happen over the next 12 months to improve care?
With this digital thing, I think it will help different areas with different diagnoses. And like when I'm in, I can only meet patients from Kwale, which are not so many. Like now, I only know one from Kwale. So the movement issue, and then your health also is not good for you to move. So the digital thing will really help a lot for us to meet different people, get encouragement, and also the what is it? Counseling, even through the phone. During my diagnosis, I wish someone could just call me or have such meetings for us to the future. I hope to see new diagnosis people so that they can get a clear picture of what cancer is, so that they can embrace it from the word go. Yeah.
Thanks very much for sharing that, Millicent. I think it's absolutely crucial patients are involved in the journey, and also, you know, the establishment of patient groups would have a profound effect in Africa. Let me just go back to Humphrey, if we can, just before we go for final thoughts. Humphrey, perhaps you could just give us an insight into the opportunities with digital technology and mental health and well-being for cancer patients.
Okay, thank you so much, Gareth. I hope you can hear me now.
Perfect.
Digital platforms is like the next move for advocacy and cancer treatment in Africa. And as Lamek has shared, for us in the support group, previously before Corona, we were meeting physically. But currently we are doing it online, and things are moving on smoothly. In terms of the medical health and psychosocial counseling, part of this can be done even digitally. If we can come up with a platform where this patient's journey, like for example, personally, in the organization, I take care of the patient's journey, that is working with them on their work plan, enlightening their treatment literacy level after assessment, and this can be done digitally. Since maybe Humphrey is the only clinician in the organization and can't attend to like all patients within the region physically, a digital platform with all this information is a best way to go. Under psychosocial counseling, most patients, myself included, when I was diagnosed with cancer, I can say that I started treatment without psychosocial counseling, and this drained me a lot. So this is a good move that the organization is putting forth, that if it can be implemented, that such that all the patients and the caregivers can be taken through this plan, at least up to the palliative level, so that they know this is a one work plan that needs to be taken care of from the start of treatment till the end of treatment. And another thing I'll add, in as much as we are doing the digital advocacy and embracing the digital platforms, we understand that based on the nature of Africa, we have those guys who may not be connected to the digital platforms, or they may not be in a position to understand English in those platforms. So as an organization, we are thinking outside the box that we also need to reach the locals through some articles which can be produced maybe on a monthly basis about cancer, written in Swahili or the local languages, and shared in the peri-urban and the rural areas, so that we just increase this knowledge of both patients on what they need to go through, and we empower them psychologically, and that can be done. We also do the YouTube videos where we do the Inspire program. That is where we share our stories as cancer survivors, and this really gives morale and motivate the cancer patients and make them believe that in as much as this journey is hard and draining, they can walk it well and successfully, and maybe have a better life in the future. Yes, thank you, Gareth.
Thanks, Humphrey. Lamek, let's come to you for some final thoughts. There's been a note put in here by Dr. Mwande saying we need to educate our community on early signs of cancer, as many as diagnosed too late. This should be done in a language they can understand. That's a very important point. One of the things that's absolutely crucial for successful cancer treatment will be to have that local engagement and to work locally. And also from an African perspective, you know, the solutions have to come from the community, from your community. Please tell us, like, summarize in 2 minutes, how you feel you can do that over the next, 12, 36, 5 years, shall we say, 36 months, what's the plan? Because one of the things I would challenge you on is the aspect of digital healthcare, which will be great, but in terms of improving patient care and outcomes, Kenya will need to look at, and other African countries will need to have centers of excellence, and for cancer treatment, they need to have a center that they can go to, understand that the treatment is given highly trained specialists. For example, if you have cancer services in multiple areas all over the place, you won't see enough of the prevalence of it. So you need to have specialist centers where people can go and get appropriate treatment. Then their outcomes will rise. They'll have a better quality of life as well, and the outcomes, they have a better, should we say, successful outcome from treatment. So tell me what you think is the next, few years for Kisumu City Cancer and raising that profile. I think you're on mute. Sorry.
Okay, thank you so much, Gareth. One of the things, according to what Nasibu has just talked about here, is that we are focusing on community local radio stations so that we can bring cancer awareness with the local language, and also bringing in the survivors to share their stories. And also out of that, we realize that people are coming out to seek medical attention, medical services. They go for screening and so on and so forth. As Kisumu City Cancer Organization, in the future, we want to emphasize more on cancer advocacy, especially within the community, whereby if we for example, one of our goal in 5 years to come is to have small satellite cancer screening center for the commonly known cancer within the region, that is cervical, breast, and prostate cancer for the men, and also to educate the community so that each and every person can take an initiative. Apart from the government putting in place the comprehensive cancer centers within the region, but we want to focus deeply into the village so that at least the village people can get to have the full information. And also we are trying to reach out to the community so that they can register, they can get registered on the National Health Scheme cover. And that is going to reduce the cost and the burden of cancer treatment.
Thanks a million, Lamek. Listen, we've had a very exciting and fascinating insight into cancer treatment in Africa this morning. I want to really thank the guests, Millicent we've lost, and Helen, unfortunately, due to technical issues. No problem at all. It was great to have the insight from Humphrey and Lamek. We're scheduling a number of talks with Kisumu City Cancer Organization, and we look forward to working in partnership with them over the next couple of years to implement the 17 Sustainable Development Goals around Kisumu City. And we're working with other African partners in terms of being able to support and help and work together to co-design solutions for local communities. From ourselves here at World Health Innovation Summit, we're delighted that you could join this session. It'll be shared across our YouTube and Facebook channels, and also across podcasts shortly. Our next session is actually around children's health and well-being, good health and well-being. It'll be hosted by Dr. Manuela Boyle. It's coming up very shortly. But from ourselves here at World Health Innovation Summit and Kisumu City Cancer Centre in Kisumu, Kenya, thank you very much for joining us, and we'll close this session. So thanks everyone, and bye-bye.